These ultraviolet rays can penetrate and damage our skin cells. There are three different types of ultraviolet rays: ultraviolet A, which we call UVA, B, and C. The C does not come down. The most of the ultraviolet rays that reach the surface of the Earth are ultraviolet A rays. These can reach up deep into the human skin and damage connective tissue and skin's DNA. The damage to any cell's DNA is the main cause of any cancer or any changes in their normal thing. Most ultraviolet B rays are absorbed by the ozone layer, which unfortunately I hear that we're destroying it all the time. So fewer of them reach the Earth's surface compared to ultraviolet A rays. The UVB rays, which help produce vitamin D in the skin, don't reach as far into the skin as ultraviolet A rays, but they can still cause sunburn and damage DNA. So they both are, we have to be careful about both of these different types of rays. The UVC rays are very dangerous, but they are absorbed completely by the ozone layer and do not reach the Earth's surface. In addition to causing sunburns, too much exposure to any ultraviolet rays can change our skin texture also. The farmers, if you remember, old farmers' skin, it becomes very leathery, very stiff, causes the skin to age prematurely, can lead to skin cancers. Ultraviolet rays also have been linked to eye conditions such as cataracts. So the National Weather Services have developed an index called UV index, and that is like an icon to forecast the risk of exposure to ultraviolet rays. The ultraviolet index predicts exposure levels on 0 to 11 positive scale. Higher level indicates the higher risk of overexposure. UV index is 3 or higher, sun protection is needed. So whenever the weather channel says that its index is more than 3, we got to be careful about it. UV index considers clouds and other local conditions that affect the amount of ultraviolet rays that reaches the ground. What are the risk factors? Anyone can get skin cancers, but there are certain people who are more prone to it with some characteristics. They are lighter natural skin color, skin that burns and freckles or reddens easily or becomes painful in sun, people with blue or green eyes, blonde or red hair, certain types and many different types of moles, family history of skin cancer, personal history of skin cancer, older age, and also I will add on to this thing, certain treatments. We are coming up with more and more chemotherapy treatments. We are noticing that certain chemotherapies can also increase the risk of skin cancers. So before we go back, so the DNA is a double helix structure in our system, and it is nicely bounded together. When the ultraviolet rays affected, it damages the DNA, and that causes the formation of the aberrant cells, and those are the cancerous ones. Exposure to UV radiation. What do? We have protection from ultraviolet radiation is very important, not only in the hot weather, all year round. It has to be done all year round, not just during the summer or when you're exposed in the beaches, when you're on the beach. Ultraviolet ray comes from the sun, can reach you on cloudy and hazy days also, just not on the bright and sunny days. It can reflect from the water, it can reflect from the cement, from the sand, in deserted areas, and also from snow. Anything white reflected can reflect and hit the skin. And same case happens when you use indoor tanning boots. Using tanning beds, boots, or sun lamps to get tan, we expose ourselves to ultraviolet radiation. The prime time when these rays are dangerous are from 10 a.m. to 4 p.m. And in daylight saving is 9 a.m. to 3 p.m. These are the most hazardous time for UV exposure outdoors in the continental United States area. Ultraviolet rays from sunlight are the greatest during the late spring and early summer in North America, like this time of the year. So next thing comes in, we cannot run away from sun. We cannot run, we like to see the brightness. So what can we do on our ends so that we don't get the damage from it? We just get the benefit from it. So the CDC has recommended easy options to protect yourself from radiation. Stay in shade, especially during midday hours. Clothing, wear clothing that covers your arms and legs. Wear a hat with a white brim to shade your face, head, ears, and neck, any exposed area. Wear sunglasses that wrap around and block both UVA and UVB rays. Just because, as we know, that ultraviolet lights can affect our eyes and the lens also. Use sunscreen with a sun protection factor of SPF of 15 or higher, and avoid indoor tanning booths. Sometimes sunburn, which we encounter, does not apparent immediately. Symptoms usually start about few hours, about 4 hours after sun exposure, and they worsen over for 24 to 36 hours, and then they can take up to 3 to 5 days to resolve. The symptoms of sunburn are redness, tenderness, swelling of the skin, blistering, headache because of dehydration, some fever, nausea, and fatigue for severe heat strokes. In addition to the skin, eyes can become sunburned. Sunburned eyes become red, dry, painful, and they feel like they are very dry and gritty, like sand is in the eyes. Chronic eye exposure can cause permanent damage to the lens, can cause early cataract, can cause vision problems. So what do we do if we have a severe sun exposure or we are suffering from the heat stroke or symptoms, as I just mentioned? Immediately take something to relieve the pain, aspirin, Tylenol, ibuprofen, whatever is okay, is fine to take. A lot of fluids to hydrate so that the headaches get better and dehydration goes away. Comfort the burns with cool baths or gentle application of cool, wet cloths so the temperature can be brought down. Avoid any further exposure until the burn has completely resolved. Use of topical moisturizing cream, aloe, or 1% hydrocortisone cream may provide additional relief if blistering occurs. Lightly cover the area with gauze to prevent any secondary infection. Try not to pop up the blisters, to let them go. When the blisters break and the skin peels, dried skin fragments can be removed, and an antiseptic ointment or hydrocortisone cream should be applied. And if seek medical attention if any of the following happens, that is, if the sunburns involves more than 15% of the body surface area, if you feel dehydrated, symptoms of dehydration, as just mentioned, headache, fever, nausea, fatigue, any fever more than 101 degrees Fahrenheit, or severe pain that persists more than 48 hours is also requires medical attention. So a tan does not indicate good health. It's more of a, your personal, how you want to see yourself, but a tan is your skin's response to injury. Tanning is, as a result, it's a burn, because the skin cells signal that they have been hurt by UV rays by producing more pigment. Any change in skin color after ultraviolet light exposure, whether it is a tan or a burn, is a sign of injury, not health. So when we say we look nice on tanning, it's really not helping ourselves. Over time, too much exposure to ultraviolet rays can cause skin cancers, including melanoma, which is the highest of the cancer, which can be fatal, basal cell carcinoma, and squamous cell carcinoma, and certain rare type of cancers also, like Merkel cell. Ultraviolet exposure can also cause cataract and cancers of the eye, like ocular melanoma. Every time we tan, we increase our risk of getting skin cancers. So as good it looks, it's not beneficial for the skin. Next. So one thing was protection. Next thing comes in, after prolonged period of damage to the skin, certain chronic exposures or multiple injuries to the skin can give rise to cancer. So how do we look for it? What we have to do? So regular skin self-exams are especially very important for the people who are at the higher risk, which I had mentioned earlier. Outdoor exposures, light skin, light color, red hair, and any of those conditions put you at the higher risk. Any family history or prior personal history of skin cancer can put you at the highest. You have to be very vigilant about it, very careful, and do a regular skin checks. And all those patients who are certain types of chemotherapy also are at the risk of skin cancer. So anybody with reduced immunity for any reason, transplant patients who are immunosuppressed to preserve their transplant, they're also at the risk of it. So all those people, they have to be very careful and do a skin self-examination. And people with strong family history of skin cancer definitely are at high risk. How often we should examine your skin? I mean, we need to find out from a dermatologist. It all depends upon how often, how is your condition. Skin self-exam is best done in a well-lit room in the front of a full-length mirror. You can use a handheld mirror to look at the areas that are hard to see, such as the back of your thighs. A spouse, a partner, a close friend, or family member may be able to help you with these exams, especially for those hard to see areas like your back or your scalp. The first time you examine your skin, spend time carefully, look over the entire surface, get familiar with your skin. Learn the pattern of moles, blemishes, freckles, and other marks on your skin so that you will notice any change next time. Be sure to show your doctor any areas that you are concerned about. Next one. Follow these step-by-step instructions to examine your skin. So check your face, neck, chest, any belly area, any folds of the skin, overhanging skin, breast, under the breast, under the area of the creases of the abdomen. If someone has has more tissue there. Check your underarms areas, both sides of your arms, the top palms of your hands, in between your fingertoes. Don't neglect those areas. Nails, make sure you check your nails because you can have subungual melanomas too. Look at the legs, look in between the toes. Many of the times we see melanomas arising at the base of the foot. People don't know that they exist, they think of a wart or something like that, but it could be one of the cancer. Use a hand mirror to examine the back of your neck and scalp with a hand mirror, part of hair for a closer look. Finally, make sure that you check your back and buttocks too. So it's a whole body, front and back, up and down checkup. So after skin protection discussion, we come to what is a skin cancer and what type of skin cancers are there. It is the most common. Skin cancer is the most common form of cancer in the United States. The two most common, which are indolent and easily managed, are skin cancers, are basal cell cancer and squamous cell carcinomas. These are highly curable, but can cause some disfigurement, scarring, and they can be, a lot of visits to dermatologists and management. The third skin cancer, common one, is melanoma. It is very fast spreading, and it is one of the skin cancer which can cause death if not caught in time or treated appropriately. Many of these lesions, the three types of skin cancer, are caused by overexposure to ultraviolet lights. So if we look at the skin can be divided into different zones. The topmost layer is the squamous cell type, and that is the top layer of the skin, and the base of the skin layer is the basal layer, which has the basaloid cells. And in between them, we have pigmented cells, melanin, which give the color to the skin, they are there. So basal cell carcinoma begins in the cells of region, which is the basal cell layer of the skin. The squamous cell carcinoma begins in the squamous layer of the skin, and melanoma begins in the melanocytes, the special cells which carry the pigment, the dark pigment, which gives color, which are the cells that make the melanin and the pigment, as I mentioned. So basal cell carcinoma, it's usually most common of these squamous and basal cell carcinomas will be in exposed area of our skin, which include our scalp, our face, our upper body, arms. So the basal cell is more like a pearly looking. The skin cancer, which often develops in the head and neck, it's shiny, it's raised, like a little crater comes in. It's raised and it's mostly rounded in growth, but depending upon the location, it can be a little oblong also. It's pink or reddish growth that it has a central crater, like something has been nicked from the center. Growth or scaly patch of the skin or near the ear. So sometimes these cancer present like a scab or a sore that doesn't heal. You peel it, you take care of it, it's gone, and then again it comes back. The scaly, slightly raised patches of irritated skin, which can be red, pink, or other colors. Mostly they're asymptomatic. Most commonly, they're very slow growing lump. You just know it is there. Sometimes people do report that there could be some signs like numbness, pins and needles, especially if it's hitting any sensory nerve there, and itching can be seen in those areas. Squamous cell carcinoma is slightly different than basal cell. Basal is shining, rounded edges. Squamous is rough, it's reddish, scaly patch, and it can be an open sore but doesn't want to heal. It scabs, scab removed, again it opens up. It can be brown spot that looks like an age spot too. And firm dome shaped, it's slightly raised overgrowth, and it can be confused easily with a wart-like growth. It can grow like a small horn is coming out, like a tiny hard scab forming the shape of a cone, tiny rhinoceros shape like horn growing out of your skin, and so developing in an old scar. If there has been a scar that was well healed and now you're seeing that it's opened up and it's becoming a wound type of thing. Most common is a sore that won't heal or return. Others have reported that sometimes all these cancers are usually asymptomatic. They're just there because you know they are there. But some people can have pins and needle-like symptoms, some tenderness, and constant itching, urge to itch on them. We do have some pictures. You can see the nose area in front of the ear, and at the bottom group there is like a horn coming out on the right, left, the black one, like a little raised hook-like thing, and scaly patches. So melanoma, as we said, is the most deadliest one if it's not taken care in time. And for melanomas, we are all being taught to know our A, B, C, D, E. This is a mnemonic to keep whenever we are looking at a pigmented lesion. Look for all these characters. A is for asymmetry. Most of the benign lesions are very well rounded, well preserved in the shape, but melanoma can be at one end a little bit more than the other, and it can be not completely rounded. B is for the border. It has irregular borders. It's not well defined. And C is for the color. So usually normal benign lesions have homogeneous or same color shade. This can be more pigmented, more darker in one area, some halo, and some can be lighter shades. So we can have different variation of the shades in one lesion. That's the discrepancy in the color makes you suspicious for melanoma. Most of the time, the D diameter, usually they are more than half a centimeter or 6 millimeter in about size. Like the easiest analogy is that if you think of a pencil eraser, that's the width of it. Mostly that's how big they are to be worried about if they are at that size. And E is evolving, like if you keep a constant check of your skin and look and keep an eye on the moles and be familiar, you will notice that if one is becoming a little larger, a little irregular, a little darker in one end. So there's a constant, some variation is taking place in the size of or the shape of the mole. So that should make you worried and, make sure that we get attention, medical help at that time. So we talked about squamous cell, we talked about basal cell, we talked about melanoma. These are the three common ones. And then there are rare cancers of the skin also, which are there, and it's not very common to see them. Merkel cell carcinoma is one of them. It's very rare. It looks like you think you've been bitten by this insect. It can be in the form of a red raised area. It can be a cyst. It can be a pimple. It's the diagnosis is based on the biopsy results. It is very aggressive, and it can be, if we find it, because right now we are living in the era where we have more and more targeted therapies. Merkel cell is one of those cancers where there is treatment available, and it does respond to treatment, provided it's really attended early on. The key thing is that it's not unlike the other squamous cell or basal cell or melanoma. It's very fast growing. Once you notice an abnormality, it grows much faster because as compared to the other cancers, so it really stays in your knowledge. It can be pink, can be red, can be purple. It usually is painless. It again develops in the exposed area, scalp, head, neck, but they can develop anywhere else too. We have seen in the nasal septum also Merkel cells. It usually appears on the skin that's got a lot of sun over the years, such as the head and neck. And Merkel cell is usually seen in little older groups, not that others are not seen in the older group also. It appears after 50 years of age, and mainly in the late age group, like in 70s and 80s, we see this diagnosis. It's one of the aggressive disease, just like melanoma, but if it is diagnosed, there is treatment available, and that can help take care of it. All these cancers have to be really addressed with people, dermatologists who take care of the skin cancers, or in a tertiary care also, especially melanoma. You need a proper surgery. Diagnosis, once the suspicion is there or diagnosis is done, a proper surgery is very important, so that we do a good job in containing it and staging it properly. Dermatofibrosarcoma protuberans, this is one of the very rare tumor, and it is associated with a mutation, and usually it's like, as the name says, it's like a sarcoma type. It is combination of the skin with a fibrous tissue, and it really grows like a protrudes. It comes out like a horn. I remember when I was doing my fellowship, we had a case, and that was the first time the treatment for that disease was really put together with the Gleevec. So because of the PDGFR mutation. So we had a patient whose tumor was just growing out like an extra, literally a horn. And once we diagnosed it and we gave him the treatment, everything washed out. Everything just regressed back as though it never existed. Before the availability of the treatment, usually the option was do a surgery. And if you can think of like a big horn coming out from your face, and if you do a surgery with a clear margin, so you'll be left with no face. Skin there. So thankfully there is treatment available, and that really works very well, and it's in the form of an oral pill. So it always sticks in my mind that the dermatofibrosarcoma protuberans because of that case. So again, this is like skin cancer. It's a small bump, can start as a small bump. It may resemble like a deep-seated pimple or a patch, but it grows in the form of a horn too, and it needs to be diagnosed and treated appropriately. Then, other than this, lymphoma is a group of disease which is basically arises from lymphoid cells, And most commonly, as we talk about lymphoma, we usually talk about the lymph glands. And many of us who have ever had any experience with cancer patients or have had anybody sick, usually lymphomas are large B cell or different type of B cells and T cells. But there is a variety of the lymphoma which only involves the skin, and when it becomes a little bit more progressive, it can involve the system, but it starts in the skin, and that is called as T cell cutaneous lymphoma. These basically look like a rash, and again, they can be nodular also. You can have lumps there, and if it is limited to the skin, then it is cutaneous T cell lymphoma or might. But if it develops, if these cells of the lymphoma cells called Sézary cells go into the blood circulation and becomes more systemic, then it becomes a Sézary syndrome. So again, it is treated much differently, no surgery. It is usually treated with chemotherapy. Before chemotherapy, it can be treated with, let me see, depending upon the stage, the medications are available for T-cell lymphoma too. It's in the form of pills and gels, and then it goes to chemotherapy. So far we talked about how, first of all, key is always in protection and prevention, and it has to start early on, and we have to be very careful about our limit of sun exposure and the hours. And simple thing, as I said earlier, we cannot run away from sun, and we want it because it has its benefits too. The key thing is the direct contact of the skin with the ultraviolet rays in the prime time. That's harmful. So if we can have a barrier between the rays and our skin in the form of clothes, in the form of sun protecting lotions, anything that can block the direct exposure is the key in prevention. And once we have anything like that, then the next step is to make sure that we seek help, remove them. We have seen people in our practices where simple squamous cell carcinoma of skin, which can be easily scraped by the dermatologist, taken care, frozen. I'm sure a lot of people have seen or heard have gone through the treatment. But if it is neglected, if it is really neglected, it can really grow and grow and grow and grow and become a big ulcer and like a bird's nest, it just keeps on growing, erodes the skin, erodes the muscle, goes deeper into the bones. And especially if it happens in the scalp and you're not paying attention, and each time you comb, you think it's a little scab, and it's not, it grows and grows and the skin stretches, it becomes a big problem. Surgical options are very limited at that point, and surgical outcomes cannot be so good that then we need to take help from radiation, we need to take help from grafting, we need to take help from chemotherapy also in case if it becomes more advanced. So something which is as simple like a small lesion can be taken care there and then can become a big problem if not paid attention to. So even squamous cell carcinoma, which is like an age-related thing or a sun-exposed thing, can be notorious. But we do have options, even if it becomes a matter at locally advanced, but it will be better if we are all responsible and take care and don't let it go that far.